Good morning and best wishes to all of us. Praise and gratitude, we pray the presence of God Almighty. We can gather in this place. I have fight and I believe you are in good health. Personally, my name is Elia Santoso. I graduated from Pharmacy Santa Clara University. Ladies and gentlemen, who has never been sick? Not there, right? Everyone in this world must have experienced pain, but from your illness to daily diseases. But you ever mentioned that there are 10 million people whose life and salvation are at stake because of what? Is it because they are very ill? Not. It's not. Their life are at stake because they abuse antibiotics. Why is that? In study, there is 50% of users will abuse the drug. The purpose of abusing the drug was that they use the drug excessively, not according to the recommended size. Maybe some people don't realize that have made a fatal mistake. They do not realize to antibiotic resistance has occurred in the pain. I'm a graduate of Pharmacy Santa Clara University. I have a pharmacy and I'm currently trying on study Atlantic antibiotic for the management of dysentery in children. This research is what motivates me to tell everyone so that they will avoid resistance. Ladies and gentlemen, there is a problem of the bill letting the bill. Here, when you came out here, I want you to understand very well about the danger of antibiotic resistance. So later you can designate its family, relatives, friends, business partners, and everyone you meet. So the degree of the number of antibiotic resistance can be realized. Therefore, I will briefly explain antibiotic and their resistance. According to Sumatru, antibiotics are organic compounds produced by foreign species of microorganisms and are toxic to other microorganism species. Meanwhile, according to WHO, which is taken from the book Dysentery antibiotic is the mutation process of microorganisms, bacteria, fungi, virus, parasites, exposed to antibiotic causing continuous infection and increasing the risk of spreading the disease to others. Ladies and gentlemen, we already understand what antibiotics are. There are many types of antibiotics that are whispered out there. There are several criteria for diseases that can be cured with antibiotic. Among other, antibiotic can be given to patients who have diseases caused by bacterial infection. Example of diseases caused due to bacterial infection are there ulcers, tuberculosis, and mosquitoes. Finally, there is to infection with E. Ladies and gentlemen, after we understand about antibiotic, now I will explain about resistance. What is resistance? Resistance is a microbial trait, not the organism or person expression of microbial infection. What is the relationship between resistance and antibiotic? The problem of resistance arises from uncontrolled use of drugs, especially antibiotic. One example is the use of drugs without a doctor prescription and not accordance with the patient clinical condition. People can easily get an antibiotic without recommendation or prescription from other health workers, especially by doctor and pharmacists. The protocols of antibiotic at health faculties, especially at most pharmacies, is carried out by the committee for self-medication without prior knowledge of the rules for using antibiotic and apparently indication from the patient contract. If you or your family are exposed to resistant disease can affect your life, both in terms of economics and life safety. These are things that the country nation does not want to happen for your family and relatives. The Indonesian government and the United Nations are what we know as United Nations are appears to stop the flow of resistance and suppress the abuse of antibiotics. They try so that they do not develop resistance. Various methods have been tried to stop resistant antibiotic resistant currents. One of them is by creating an ASP. What is an ASP? ASP is Antimicrobial Stewardship Program. Therefore, there need to be a response from the UN and the government. What are their goals regarding the ESP, how the USP, and how the effect of antibiotic abuse? Okay, let me explain one by one. The main objective of ASP is the optimize the use of should be antibiotic to improve clinical outcomes were minimized. Antibiotic use with the presence of ESP, which will increase the safety patient for use antibiotic as well as improve the quality of commonly access and promote and increase the safety of antibiotic, and also reduce the resistant problem because be controlled use of drug as well as antibiotic people get antibiotic. Actually, we talk the need for cover later as we talk about pharmacies. Antibiotics are not drugs. The salty, chestnut, and F45 antibiotics are wild drugs, very important in healing your process. However, if it's a conscious quantity, of course, the well-being factor is. Ladies and gentlemen, I hope that what I have provided can be referenced and add insight to all of you. Remember to take antibiotic drug currently according to rules of use. This is all, and thank you.